This is a plain scan of left lower limb CT angiogram. Please observe heavily calcified erythematous plaques and tunica media calcifications, making almost casts of most of the arteries of left lower limb. In such cases, it becomes really difficult to interpret the CT angiogram because the blood vessels or arteries, they are heavily calcified. Now please observe these heavy calcifications making the casts of these arteries. Now this is CT angiogram. You find mild luminal narrowings of lower part of abdominal aorta and left common iliac artery, while moderate luminal narrowings of left external iliac artery are present. This basically was done for left lower limb. Now please observe moderate, almost 50% diameter stenosis of left common iliac, external iliac artery. Now from this region onwards, left femoral artery is not opacified. Now please observe, this is right femoral artery here. Left femoral artery is not opacified. Now this is the right superficial femoral artery. This is profunda femoris artery. Although these were heavily calcified, but even then their lumens are opacified by the contrast medium. While on left side, the lumen is not opacified, so there is complete thrombosis of left superficial femoral artery, popliteal artery, posterior tibial artery, anterior tibial artery, and dorsalis pedis artery. None of these arteries is opacified. Now I will show you the 3D images. Please observe that 3D images could be very misleading because the casts made by the erythematous plaques and tunica media calcifications, they mimic the arterial lumens as if they are patent. Please observe the cast made by the tunica media calcifications. This is the anterior tibial artery, this is peroneal artery, and this is the posterior tibial artery. Although these were thrombosed on left side, but the computer generated images, they show as if these arteries are patent. So it is always advisable that you make a note at the end of the report that please rely upon the written report and not upon the computer generated images, because these may induct the heavily calcified tunica media and misinterpret as the patent lumens, and also the blood vessels which are lying in close proximity to the bones, they may not be picked up by the 3D reconstructed images.